Medication errors due to staffing shortages is a national healthcare crisis. There are many risk factors that contribute to medication errors and many steps that can be implemented to prevent medication errors from occurring. Unsafe medication practices are the leading cause of avoidable patient harm within the healthcare system. Medication errors are life-threatening and can cause significant harm, disability, and death if not managed correctly. Medication errors can occur at any stage of the medication use process. For example, during the prescribing, transcribing, dispensing, and administering. However, most studies show that medication errors usually occur during the medication administration stage. Most of the medications administered to patients in a hospital setting are by a registered nurse. The errors are derived from wrong dosage, wrong time, wrong medication, wrong route, wrong patient, lack of documentation, and technical errors. This contradicts the 7 rights of medication administration, a standardized healthcare model used to prevent medication errors. Medication errors pose dangerous consequences for the patient, healthcare professionals, and healthcare institutions. The nursing profession continues to face staff shortages, high turnover rates, and inequitable workload distribution. Despite the increase in demand, more nurses are leaving the profession due to various reasons. This brings us to the research problem. In acute care setting, how do high patient-to-nurse ratios affect the incidence of medication errors? A study was conducted as a quantitative institution-based cross-sectional study in a local hospital here in Arizona. The sample size included a patient population of 20 to 30 patients, including their nurses, on an intensive care unit floor who met the criteria. The study took place over a 60-day span, observing different nurse-to-patient care, specifically medication errors. The study monitored the use of safe medication administration rights and adherence by staff members. The target population included all nurses working within the hospital system and randomly selected nurses who had a minimum diploma qualification in nursing. Nurses that were also involved in the study if they had 1 year minimum or more work experience where they were involved in direct patient care. The data collected were supported by a structured self-administered questionnaire of 43 items arranged in 5 sections. The questions were designed to select yes or no responses, and the sections were focused on the demographic features of the participating nurse, work-related experiences, and the rate and magnitude of medication errors. Lastly, the questionnaire also included a section on how many times has the nurse self-reported medication errors. The data and research reflected the research problem as the questionnaires revealed the medication errors are still being committed by medical professionals, which compromises patient safety and care. Through the self-administered questionnaire, nurses reported that medication errors were commonly made due to failure to administer medication at the right time, and according to 57.8% of nurses had reported that medications were given out of the time frame of when the medication was due. Followed by a breach in documentation reported by 24.8% of nurses and incorrect dosage at 22.5% of nurses. Lastly, nurses reported about 11.7% of patients were given the wrong medication and 8.7% of medications were given to the wrong patient. Contributing factors associated with medication administration errors were explored through binary logistic regression. In multiple logistic regression analysis, factors such as work experience, adequate education and training, interpretation during medication administration, and nurse-to-patient ratios contributed to the incidence of errors. Nurses who did not have proper training or education for medication administration were 2 times more likely to make errors. Nurses who had an overwhelming number of patients and have not been trained on safe medication administration protocols were 3 times more likely to make an error. With the information of the study, the nursing student was able to logically build a case for research. Based on these findings, the safety of inpatients receiving drug therapy in a hospital setting was compromised. The provision and adherence to guidelines during medication administration were breached, which supports the need for further education and teaching. Medication administration errors can be prevented if the correct tools and steps are in place and adhered to. The study supports the need for creating an environment for nurses to train on the safe administration of medication in a healthcare setting to ensure the safety of patients. The exercise supported by my interpretation of published research by seeing the need to improve staff ratios to prevent medication errors and provide safe patient care. The study also guided the implementation of evidence-based practices because it offers a series of steps that will support techniques and strategies on how to deliver safe and effective patient care.